we have our session 5 for today, that is Best of Hospital Innovations Showcase. This is a very interesting session whereby CAHO is all about sharing knowledge and sharing best practices. We will be seeing some of the best practices in terms of hospital innovations in this session, where we have Dr. Gyani with us. Dr. Gyani needs no introduction, and I don't know how in few words and sentences I can actually introduce such a great personality who has brought about a change in the quality movement in healthcare across the country. He's currently the Director General of the Association of Healthcare Providers in India, AHPI, and he was the Secretary General of Quality Council of India from 2003 to 2012. The SME World magazine, in its cover story of the June 2012 issue, described him as the quality man of India. Until today, all of us know him as the quality man of India. Dr. Gyani has been instrumental in formulation and operating of NABH for hospitals and healthcare providers for the first time in the country. He's been a pioneer for ensuring that the quality movement in healthcare organizations happen in our country. And Dr. Gyani functioned as the founder CEO of NABH until July 2012. My honor and my privilege to invite and welcome Dr. Gyani. Over to you, sir.
Yeah, thank you, Anu. I think this has been an exciting day all through. Not only today, I think past 2 days we have been listening to CAHO. I think very high value addition program. So far, I think we have been, waiting for certain international program to attend, and I think those days are gone. I think our CAHO platform has become truly global platform in terms of patient safety and quality of care. So I am just eagerly waiting to listen to the speaker in the session. Please go ahead.
Dr. Gyani, we have first Nanavati Max Super Specialty Hospital, Mumbai.
Yeah.
Innovation, the topic is artificial intelligence based software, rapid AI, and the presenter is Dr. Gauri, Rani. Yes, she's here. Please go ahead.
Good evening, everyone. My name is Dr. Gauri, Rani. I'm a consultant radiologist at Nanavati Max Super Specialty Hospital. So on behalf of my team at Nanavati, I'll be talking about adoption of the AI-based software Rapid AI, which is used for assessment of stroke at our institute. We have a code-wide protocol at Nanavati Hospital for patients who come in with a stroke or suspected stroke, of which the Rapid AI is a part of. So what is stroke? It is caused due to blood flow and perfusion, which can be due to a thrombus, that's a clot, or a hemorrhage, that is due to the rupture of the vessel. Now, the treatment for both is exactly different. If it's a clot or a thrombus, you need to remove it. If it's a hemorrhage due to a ruptured vessel, you need to stop the bleeding. Now, patients who come in with stroke usually will have complaints like drooping of the face, weakness of the arms, speech difficulties, blurring of vision, and the outcome can go two ways. Either you send the patient home completely, almost back to normal with a big smile on his face, or the patient goes home bedridden with severe disability. Now, the thing that determines the outcome is timely intervention. Timely intervention is the key for management of stroke. Every second counts. Every minute you lose, you are losing 1.9 million neurons. Now, the awareness about PAMI, that is percutaneous angioplasty for myocardial infarction, that is, it's quite more. But somehow the awareness for stroke, the window period that is there in stroke is not as much. And we need to really spread education and awareness regarding that. So the time is very important as far as stroke management is concerned. Before I go into the Rapid AI software, I would just like to talk about the entity salvageable penumbra. Whenever there is a blood clot which hampers the blood supply to the brain, there is a part which is completely devoid of blood supply, which is dead, that is ischemic cord. But there's an area around it, which is called the salvageable penumbra, which is the tissue at risk, but it's not completely dead. So it is our role to basically save this area of salvageable penumbra. The role of a radiologist is to give an accurate and a precise volume of this penumbra so as to guide the neurologist, and we have to do it rapidly because every second is important. Hence the role of the Rapid AI software. It's an artificial intelligence-based tool. It's a server-based solution. So it gives the penumbra volume within seconds. We use the diffusion and the perfusion images which are acquired on an MRI scanner, which gets uploaded onto the server, and these are used to calculate the penumbra volume. The results then help us to identify which patients would benefit from a mechanical thrombectomy or an IV thrombolysis. Certain parameters are given by the software like mismatch volume. Now, another advantage of this software is that there is no manual intervention in this. So even if the radiologist is absent, either because of time constraints or because of resource constraints, you still have a software which is automatically calculating the values. Therefore, it may this. Just to go over an example, here you have your MRI of the brain, where you see this white part, that is the dead parenchyma. Now, this is due to a clot in the blood vessel. As you can see here, the right side is normal. On the left, there is no blood vessel seen. So probably due to a clot here. Now, the rapid AI images show this pink part, that is the dead part, and the green part, that is the area of the salvageable penumbra. As you can see, the pink part is just 13 ml, whereas this green part is almost 155 ml. So there is a big mismatch of 142 ml. Our aim is to save this green part from dying. And how we can do it is if you intervene timely and you remove this clot here in the blood vessel. Now, the Rapid AI software also gives us these color-coded maps and charts that help us in easy assessment of the diagrams that it gives us. Now, these values and these volumes could be calculated manually as well. But however, a radiologist might take about 5 minutes to calculate these volumes, which are given to us by the software within seconds. Also, there might be some manual errors, and there is always some amount of inter-observer variability, which is completely eliminated with the help of the software. These values are really relevant clinically because they help to determine the further treatment. To look over a similar example, you have the pre-treatment images and the post-thrombectomy images. Here, what you see, the white is the dead tissue. The black and the blue is the salvageable penumbra. Now, the infarct is because of a clot in the blood vessel here. The right is normal. Left, there are no vessels seen here due to a cutoff, which was due to a clot, which was removed by a mechanical thrombectomy. In the post-thrombectomy scan, what you see is the black and the blue part, which was much larger, has now all become green and red. That means that the area of the salvageable penumbra has been reperfused. The vessel has been recanalized. The vessel is opened up. As you can see here, you can see the peripheral blood vessels. Also, in the Rapid AI images, what you see is the green part, which is almost 155 ml, that is the area of salvageable penumbra, is now just 3 ml. So it's almost completely reverted back to normal. So now, just to sum it up, I would just like to say time is brief. So Rapid AI gives us quick and precise volumes. It's automated, therefore it avoids any interoperable variability and any errors that may occur manually. It's convenient. It also gives us the values in a mobile format, so we can view it even if we are on the go. It helps in triage of patients to decide what treatment the patient is to be given, whether the patient is to go for an intervention or not. It gives us the values very speedily, which is very important because time is really important as far as stroke management is concerned. It has significantly reduced our door-to-needle time, and it has really augmented radiologists. It's increased our efficiency significantly. At Nanavati Hospital, our stroke program is one of the highest priority programs we have here. So we have these set processes which occur whenever a patient with stroke comes to the hospital. And we constantly audit these processes. And this addition of the Rapid AI software has significantly helped us to reduce our door-to-needle time, which was initially almost over an hour to now almost to about 30 to 35 minutes. We scan about 1 stroke patient every day. And so far, we've done about 38 interventions, including both IV thrombolysis as well as mechanical thrombectomies. So the outcome of stroke management has really significantly improved, and the software has definitely aided us in being more efficient and giving a better result. Also, another benefit that we saw with the software was that, especially when there are younger radiologists who are maybe not as experienced, who are on call and who gets these difficult scans, who might need a second opinion, the software has definitely helped in that aspect as well. At Nanavati, for the Rapid AI software, we have a hub and spoke model where Nanavati is a hub, and we receive scans and images from smaller diagnostic centers around the hospital. And if we find that the results are significant, then we can get those patients to Nanavati Hospital in time so that they can receive the required intervention. And therefore, you can save a lot of patients, from a significant disability which stroke is known to cause. So I would just like to end by saying that the software has really augmented our reporting. It's really helped us. And so every minute for stroke management is really important. And it's really been a boon to have the software with us. I would just like to thank the organizers at CAHOTECH and my mentor, Dr. Parkar sir, my colleagues, Dr. Mitusha Kaustubh and Mr. Nishant as well. Thank you so much for the opportunity. Thank you.
Thank you, Dr. Gauri. Sir, Dr. Gyani, any comments, questions?
From my side, of course, the advantages are so obvious in terms of speed and in terms of, it is helping the radiologists themselves, so that radiologists, whatever they have been doing now with this intervention, they are going to be more accurate. And to me, the less, time from door to needle time is very good feature of this presentation. Well done, very well done.
Thank you so much.
So, Dr. Rani, I had a question.
Yes.
Did you have any resistance in using the data by the doctor and the interventionist? Because earlier he was used to a radiologist report, and now you're giving something immediately. So was there resistance, or was it?
No, sir. In fact, just the opposite. It's been quite acceptable because radiologist reporting is still there. So we still give it, whether it's an infarct or whether this is useful in cases of ischemic strokes where you have an ischemia, a blood clot. So we need to give that first, whether it's an ischemic stroke or whether it's a hemorrhagic stroke. The way the software has helped us is it's reduced that time which we would otherwise require to calculate these volumes manually. So it has really aided us in that. So in fact, because the time has been significantly shortened, the interventionists and the neurologists are in fact significantly happy with the software.
Thank you so much.
Thank you, sir.
Speaker, thank you, Dr. Gauri. That was excellent.
Thank you, Dr. Anna. Thank you so much.